get back to the pandemic and catch up with the Federal Health Minister, Greg Hunt, who joins me now live. Thanks for joining us, Greg. I want to ask you first up, let me go to the vaccine first up. You've made this major announcement about the vaccine, the one from Oxford University that we're, around the world, people are quite optimistic about. Best case scenario, you're suggesting that Australians could actually be getting access to this vaccine in the first half of next year?
Correct. So we've secured 84.8 million doses of two vaccines, the Oxford AstraZeneca vaccine, that's an important one, and 51 million doses of the University of Queensland molecular clamp. The Oxford University vaccine we're expecting will arrive in Australia, as well as being produced in Australia from the first quarter of next year, with potentially the first vaccinations in January and February. And then between the two vaccines, they'd be rolled out over the course of the coming months through to the second quarter and the third quarter. And that's an immensely important step forward for Australia. We've been cautious on vaccines. We've been very careful in selecting. We haven't contracted until we had data, we had evidence, we had safety, we had efficacy or effectiveness. But now we're in a position where we believe that these two vaccines are best in class, two of the world's leading, if not the two leading vaccines in the world. And both of them will be produced here in Australia under a sovereign vaccine program, and one of them is an Australian vaccine.
To what extent do we have any knowledge about their level of effectiveness? So the experts tell us some vaccines obviously are more effective than others. You can get a vaccine out there that will provide some cover. Do we have any knowledge at this stage just what to expect in that regard?
Sure. So I spoke with Professor Sarah Gilbert at the weekend. She's the head of the vaccine program at Oxford. They've had very strong what are called antibody and T-cell responses so far. They've already had clinical trials, early phase clinical trials. They're now proceeding through their phase 3 clinical trial, where ultimately they'll have 50,000 participants. They're very confident in the direction, firstly and most importantly in terms of the safety, but secondly in terms of the effectiveness. The best advice that she and the Oxford team and their presentation in the Lancet Journal have been able to give is that it's likely to provide multi-year protection, not necessarily lifetime. They're certainly not making that claim, but unlike the flu, not required annually. The full duration will be determined and the full effectiveness will be determined, but very promising. Similarly, the University of Queensland vaccine, I spoke with Professor Paul Young, who's the head of that program. Similar results from the preclinical trials in terms of the antibody and the T-cell response. Also expecting it to be a multi-year, not necessarily lifetime, but again, unlike the flu, not annual. And so we're in a fortunate position to have access to these because we have the manufacturing capability in Australia. It means we don't have to wait. It means we can choose the best in class, but then be able to produce them here and deliver them to the Australian people on a free and voluntary basis.
So are you saying that there is every likelihood this will be the game changer, that when we get this vaccine, it will be able to give us that immunity across the population? In other words, the draconian measures we've got in place with our overseas quarantine, bans on overseas travel, a lot of the lockdown measures around the states will only have to be in place until that vaccine's available in the first half of next year?
That's our hope, that's our expectation, and that's our belief. In particular, what's important, obviously, is to encourage as many Australians to take this up, but we have been great vaccinators. We've got a 94.8% childhood immunisation rate for 5-year-olds. Through the course of the pandemic, we've achieved record results, which is an extraordinary testament to our health system, our education system, and to our mums and dads around the country who've taken up vaccinations. So we are one of the world's great vaccination nations.
But are you confident enough about this vaccine that you can say we have to stop, we can stop thinking about planning to live with this virus? We will have this vaccine. It will be effective.
Well, we've always got a plan A and a plan B, but my expectation and my belief is that we will have a successful vaccine, and indeed the world will likely have multiple successful vaccines. We have invested in two different types of vaccine. One, a viral vector vaccine. One of them, a recombinant protein vaccine. To have two different types. That gives us different opportunities in case one were not successful, but all the expectation is that both will be. That will change the circumstances, of course. Yeah. We will get back to our lives. The world has done this. We've been through multiple different diseases. This is a 1 in 100 year, the worst we've faced as a globe since the Spanish flu. But there is real light and real hope and real optimism. And as you know, I've been cautious on vaccines. But now that the data, the science, the evidence has been reviewed in Australia and internationally, I'm increasingly confident and hopeful.
Well, that's very hopeful indeed, and that's what we want to hear. So let's hope that that all comes to fruition next year. Thanks so much for joining us, Greg.
Thanks, Chris.
Greg Hunt there, the Federal Health Minister. I wanted to talk to him about Daniel Andrews' plan as well, but I just found that stuff so fascinating. I hope you did too, because we all hope for a vaccine. We want a vaccine that's highly effective and widely available. I've never seen Greg Hunt looking so optimistic about that. Let's hope he's right. Let's hope we get hold of that next year, because that means all of this hardship that some people around the country are experiencing worse than others, particularly in Victoria, could be a thing of the past by halfway through next year. Hang in there.